pain in the knee joint, right? So if the patient has middle meniscal tear, yes, that can produce pain. If the patient has anterior ACL tear or posterior cruciate ligament tear, even that can cause instability, that can cause pain, that can cause stiffness of the joint. There are so many other conditions, right? So there could be rheumatoid arthritis in a younger age group. So there are so many conditions which can produce pain in and around the joint. So it's my sincere request to the family physicians who are sitting here, it becomes an imperative thing to find out the exact diagnosis, where the exact pain is coming from, where is the exact pathology. Okay, so once we have ruled out all other problems, then when only we can, there are some clinical findings of course, then only you can come to the diagnosis of osteoarthritis. Okay, that's very important thing. So let us jump into some of the case discussions. As I told you, I have got cases to be discussed. So let us go with a common scenario where there is a patient comes with a 50 years plus old housewife with early signs of osteoarthritis. Our presentation will be what are the clinical features which we look into it for her diagnosis, right? So let us take a case profile where a female 52-year-old woman presenting with complaint of mild to moderate knee pain, which is roughly around 2 months. So patient will have stiffness for about 15-20 minutes when she gets up in the early morning. There's early morning stiffness. So patient will have some difficulty in folding her knees while sitting on the ground, right? So especially in our India, as we know, we are basically we come from the floor sitting culture, right? So for most of the things, right, even for toilet we sit on the floor itself. Most of the villages, most of the rural areas, they doesn't have our foreign type of lavatories, right? So we use that lattice when we have to sit down, we have to squat, right? So even so many cultures, even for doing puja, we'll sit on the ground, or for eating food also we'll sit on the ground, especially rural people, they don't have dining table, all those things, right? So patients with the knee pain, definitely they will have some problem in sitting on the ground. That's one of the major complaints to what they present with, right? Especially females of that age, housewives, they need to wash their clothes, or they need to wash the utensils. So for all those, most of the activities, they want to cut the vegetables, all those things, they want to sit on the ground. Okay, so that is one of the problems they face whenever the patient has knee pain. So what are the past medical history of that particular patient? She is a known time to diabetes mellitus. So she is since past 9 years she is on treatment. So she gives history when 3 years back she had an accident where her knee got collided, and she is having on and off pain since that injury, right? So it's a socio-economic history. She is working as an accountant in one of the software companies from since past 11 years. Presently she is housewife. Her personal history, she is married and she has 2 children. Social history, of course, she was earlier a smoker, now she is reformed, and occasionally she consumes alcohol. So what are the other case profile? Physical examination, patient is afferable at the time of presentation. Rest of vitals are very normal. There is mild inflammation in both the knee joints, and some amount of crepitus is present. Okay, so what will be our provisional diagnosis? So coming to some of the blood parameters, everything is fine except for ESR is mildly raised around 35 millimeters. That's it. So especially our glycated hemoglobin 7.2%. And one more important thing you want to see here is her. Please look into your vitamin D level. That is about 32 nanograms, right? So she has a diabetes which is uncontrolled, and there is low level of vitamin D. That also very very crucial in this particular point. As I discuss further, you will come to know what's its importance. So on taking an X-ray, there is anterior-posterior view in supine position which shows definite joint space narrowing. We call as Kellengren grade 2. So if you look into the your joint space, especially if you look the joint space medially, there is definite reduction in the joint space, right? So if you just once again, yeah, if you look here, I'll just enlarge for you. Yeah, so this is the AP view. If you see the lateral joint space, there is definite some amount of the. If you see the medial joint space, definitely there is narrowing, right? It's a classical finding of osteoarthritis, wherein, as we know, it's the medial compartment which bears the 60% of the body weight, whereas the lateral compartment is just 40%. So as we know, most of the weight is taken from the medial compartment of the knee joint. So it will be more of wear and tear in the medial compartment. Hence, we first find out the osteoarthritis changes in the medial compartment of the knee, right? So you can definitely find out this in both the APV of both the joints, right? So what would be our final diagnosis? As we know, it's a bilateral osteoarthritis of knee, grade 2. So what to consider when deciding treatment for this particular patient? So there are do comorbidities such as type 2 diabetes mellitus and vitamin D deficiency influence the progression or onset of osteoarthritis in this case? What are the various non-pharmacological treatment that's available and what are the other different pharmacological approaches, right? So what are the factors that decide treatment selection? So one is the age, as we know, 45 plus years, 50 plus years, and 60 plus years, and this particular case is 50 plus year woman. So what's her level of activity? She's housewife or low moderate activity, and what are the intensity of the pain patient is suffering from? It's a new onset, as you know, it's just from past 2 months, and it's mild to moderate, not that very serious. So what are the factors that decide treatment selection? So one is the knee flexibility, where the patient has mild to moderate stiffness. There is no impact on mobility as such. She is able to do her routine activities. So there is definitely a cartilage degradation which is of low degree, not that moderate or severe, it's just a low degree. So what are the prevalence of age-related diagnosis of osteoarthritis and associated activities limitation? So 52% of higher risk of patients who are suffering from knee in the early age, they do have higher risk of involving hand, knee and hip osteoarthritis, especially in women who are aged than more 50 years. So what are the other quantifying risk factors for the onset of osteoarthritis? That's endocrinological disorders and trauma. As I told you, this particular patient had a collision of her knee joint in the past history. And if you see this is very, very important slide. Please, all of you, see it properly. So there is threefold higher risk of osteoarthritis knee in patient with low levels of vitamin D. Please consider this. See, whenever a patient does vitamin D at a lower level, there's three times. There's 3 times chance of such patients getting osteoarthritis of the knee joint. So this is one of the recent things which we have found out. So as we know, most of our, especially, I still remember one of the companies, they collected the blood samples from some of the orthopedic surgeons who are practicing in Karnataka. So I think they collected the blood samples of for around 100 plus orthopedic surgeons. They could find out that nearly 90% of them had low vitamin D level. Can you believe this? Right? See, it's because our sun exposure is very less, and so many other factors play an important role. So most of our Indians, I think nearly 80 to 90% of them, we have low vitamin D level in our system as such. So that's one of the reasons why there is threefold increase in osteoarthritis of the knee. So my sincere request to the general practitioners who are there here, please, whenever you see a patient with osteoarthritis, whenever you see a patient with above 40 years of age, please put them on one dose of vitamin D, right? So we usually prescribe, as you know, I think most of you will be knowing, we'll be prescribing once a week for about 8 weeks, followed by one sachet of thing for 1 month, every month for another 8 months. That's the standard dosage of treatment of vitamin D. Then type 2 diabetes is also has incidence of 25% higher frequency of osteoarthritis knee. As I told you, patients with diabetes and who are smokers, who are obese, even though these patients have higher risk of osteoarthritis in right. So there is, as these slides tell you us, that 25% of there is higher chance of patients suffering from osteoarthritis, they suffer from type 2 diabetes especially. So post trauma, yes, 12% of the all osteoarthritis patients do come up with the history of any injury to the knee joint. Maybe especially our agricultural patients who are in the rural area, right? Say they are mainly basically they are laborers, right? Now they'll be doing a lot of activities in the fields. They'll be lifting the weight and so many activities they'll be doing, and they'll be walking around uneven surfaces in the farmlands and all those things. There are high chances they'll slip and fall down, or there will be some injuries, and it could be some injuries while playing also. See, sports injuries could be there, especially in their childhood or in their adolescent age. So there are so many conditions where there will be history of injury to the knee joint. So that will produce what is called as post-traumatic osteoarthritis knee. That comes under secondary osteoarthritis, of course. So these three important things one should keep in mind whenever you see osteoarthritis patient. There could be vitamin D levels can be low, or patient maybe a diabetic, we don't know, or there could be history of osteoarthritis into them. So we need to establish what's the goals of treatment, right? Just prescribing some painkillers, it doesn't help. See, patient can as well as take some painkillers for themselves in their house. Nowadays, because of our social media, we do get a lot of prescription on the WhatsApp itself, right? So there will be so many forwards and forward messages, so many things. So just taking painkiller is not sufficient. That's the thing one should understand here, right? So what are the goals of treatment? One is decrease the narrowing of joint space. That's very important. We need to prevent the progression of the osteoarthritis. That's very, very important. So we have to prevent the further structural damage. See, as I told you earlier, your osteoarthritis knee joint is basically there is a degradation of the articular surface. We need to prevent that further structural damage to the joint surface. What can be done for that? I will tell you in the future slides. So we need to provide symptomatic relief also, and we should reduce the requirement of multiple drug usage for symptomatic relief and delay the need for joint arthroplasty. So these are the goals of treatment, right? So what are the pharmacotherapy that is available for knee osteoarthritis? So what are the various things that are available? Depending on the patient presenting with symptomatic knee osteoarthritis, we have step 1, step 2, and step 3, right? So in step 1, as initiated by chronic cyst therapy, so we need to consider glucosamine sulfate and chondroitin sulfate, and we can always add short-term rescue of acetaminophen therapy also, and whenever needed we can apply local NSAIDs gels, and all those things can also be tried. Whereas in step 2, patient has severely symptomatic, we can always go for NSAIDs, and of course we do have some increased of GI risk and increased CV risk and increased renal risk also, and depending on the safety profile we can definitely choose some painkillers like ibuprofen, and we can use some NSAIDs also, and we can even think of adding intra-articular hyaluronic acid and corticosteroid injections also. Whereas in step 3, we can give even short-term weak opioids like your tramadol or duloxetine can also be used in the case of step 3. What are the other non-pharmacological interventions which are needed, which are advisable in knee OA? So coming to a level of consensus, there is a high level of consensus for the especially aquatic exercise. When I say aquatic exercise, what I mean to say is we need to advise the patient to do some non-weight bearing exercise. See, that's very, very important. As we know, knee being an weight bearing joint, whenever the patient puts weight or puts load on the knee joint, there is the chances that there is wear and tear of the joint, right? So long-term standing, long-term walking, and any weight-bearing activities like skipping, then all those things, now all those climbing stairs, all those things better to be avoided, right? So when you say aquatic exercise, like patient doing swimming should be good, or any non-weight bearing exercise like your cycling, right? Static cycling where there is no load on the knee joint, right? Or any static quadriceps exercise, and any swimming and static cycling. All these are the exercises, or any exercise which are quadriceps exercise, strengthening exercise with the patient does on the sleeping on the couch, right? So all these are the exercises where these are called as non-load bearing or non-weight bearing exercise. So these are the primarily exercises that we need to explain to the patient so that there is not much load on the knee joint, still you are strengthening the quadriceps muscles, right? So the quadriceps muscles has to be strengthened very, very, very keenly. That's because we call it as the quadriceps is called as powerhouse of the thigh. So that is the strongest muscle which is there in the anterior compartment of the thigh, which will take the maximum load while walking and all things. So if you strengthen the quadriceps muscle, automatically the stress and strain which has to be routine, which will fall on the knee joint in the routine activities, that will be taken up by these muscles, right? So if you strengthen the muscles, that will play very, very keen role in controlling or in managing the osteoarthritis patients. Then of course gait aids, if the patient has, you can definitely use the walking sticks and also gating aids. Then self-management programs will come to that. Then we can give them cognitive behavioral therapy also. So what are the benefits of pharmacotherapy in osteoarthritis? So there is a relatively comparable efficacy in terms of pain relief. Definitely when you take painkillers, the moment of pain is definitely taken care of. So they do provide symptom relief by targeting the cause of osteoarthritis, typically some counterproductive in action. So they have limited influence on cyclooxygen enzyme. They provide NSAID sparing effect. They will limit in the progressive of osteoarthritis. They do treat destructive changes of osteoarthritis. So this is a beautiful slide, my dear colleagues. So what I tell my patient is this RDEL approach. This is a mantra. RDEL approach. What is RDEL? R for right, D for diet, E for exercise, and L for lifestyle. Right? So R diet, or D for diet. See, the patient keeps his body weight under control. Takes a nutritious, protein nutritious, and vitamin D rich, calcium rich food. Definitely, that is going to build up in good muscular cell system in his body, and that will definitely see that his osteoarthritis doesn't progress further. Right? The patient is obviously, I've got a good classical example where one of my patients, I think he was around 92 or 95 kgs weight. So he met with an accident. He had a very bad injury, thigh fracture, femur bone fracture. Then he had a head injury also. Because of head injury, he was in ICU for nearly, I think it was nearly for about 1.5 months. He was in ICU. As you know, he was put on only on IV fluids and some oral these things. So his reduction, he was in coma for nearly 1.5 months. So his weight was reduced like anything. The person was 90 plus. By the time he was coming out of the ICU, his weight was say around, I think it was around 70 plus or so. There is drastic loss of weight. So that patient has moderate osteoarthritis of the knee joint. So of course we fixed the fracture femur and he was fine. He went back and he came back to us for follow up after say about 3 months. So I just inquired him in our OPD how is his knee pain. He was so happy. His weight has reduced so much, and now the pain is almost. He says there is no pain, sir. Knee joint. I am comfortable now. Mainly because of the weight of the body. I think I was having a lot of pain in the knee joint. Once because of head injury and ICU, all those things, my weight has come down, and I'm very comfortable now. See, that is the importance of weight that causes your osteoarthritis. So that is the importance, right? So if you reduce your body weight, that is going very, very long way. Right. Once again, there is some issue with the charging. Please give me a minute. ಲಕ್ಷಣ ಕರೀಲ್ದವ್ರೆ ಆಗ್ತಾ ಇಲ್ವಾ ಎಷ್ಟು ಟೈಮ್ ಆಯ್ತು ರೀ ಎಷ್ಟು ಗಂಟೆ ಮಾಡಿದೆ ಎಷ್ಟು ಟೈಮ್ ಆಯಿತು ನೀನು ಆಪ್ರೇಟ್ ಇವಾಗ ಅವಳು ಕರಿ ಆಪ್ರೇಟ್ ಆಗ್ತದೆ ರೇಷನ್ ಕರಿ ಅಲ್ಲ ಅವ್ರು ಚಾರ್ಜ್ ಆಗ್ತಿದೆಯಲ್ಲ Yeah, 1 second, friends. There is some technical error. We'll take care of it. ಯಾವುದು ಯೂಟ್ಯೂಬ್ ಅಲ್ಲ ಇವ ಸ್ಲೈಡ್ಸ್ ಬರೋದ್ರ ಹಾಕ್ಕೊಳ್ಬೇಕು ಕೂತ್ಕೊಂಡು ಸ್ಲೈಡ್ಸ್ ತೊಗೊಬೇಕು ಹೌದಾ ಆಗಲ್ವಾ ಇವಾಗ ಅಪ್ಡೇಟ್ ಆಗೋದು ಏನು ಮಾಡಿದ್ರಿ ಕರೆದ್ರಾ ಮಧ್ಯಾಹ್ನ ಯಾಕೋ ಅಪ್ಡೇಟ್ ಅಂತ ಹೊಡೆದು ಯಾವ ಅಪ್ಡೇಟ್ ಇವಾಗ
ನೀನು ಎಸ್ ಅಂತ ಗೊತ್ತಿದಾ ವೇಟ್ ಏನಾರು ಅಂತ ಕೊಡ್ಲಿಲ್ವಾ ಅದಿನಾಗಲ್ಲ ಇನ್ನ
ನಾನೇನು ಅಪ್ಡೇಟ್ ಆಗಲಿ ಬಿಡು ಅಂತ ಕೊಟ್ಬಿಟ್ಟೆ ಹೋಗ್ಲಿ ಇದು ತೊಗೊಳಪ್ಪ ಇನ್ನೊಂದು ಕಂಪ್ಯೂಟರ್ ತಗೋ
ಅದು ಲೈವ್ ಪಾಸ್ ಮಾಡಿ
ಏನು ಪಾಸ್ ಮಾಡ್ಕೊಳ್ತೇನೆ ಎಲ್ಲಿದೆ ಅದು
ಬ್ಯಾಕ್ ಹೋಗಿ ಮಾಡ್ತೀನಿ ಅಯ್ಯೋ ಆ ಲ್ಯಾಪ್ಟಾಪ್ ಸಪೋರ್ಟ್ ಮಾಡಲ್ಲ ಹೊಸ ಬುಕ್ಸ್.
ಯಾವುದು ನೋಡ್ಬಾ ಒಂದು ನಿಮಿಷ ನೋಡ್ಬಾ.
ನೀನು ಕರೆಯುತ್ತಾನೆ ಬೇಟೆ ನಾನಂತ ಕೊಟ್ಟಿದ್ರೆ ಏನಾಗ್ತಿತ್ತು ನಿಮಗೆ?
ಯಾರಿಗೆ ಗೊತ್ತು, ಚಾರ್ಜ್ ಇರಲಿಲ್ವಾ? ಏನಾಗ್ಬಿಡುತ್ತೆ ಬಿಡಿದ್ರೆ ಮಾಡಿಸೋದು.
ಲೈವ್ ಇದೆಯಲ್ಲ ಆಫ್ ಮಾಡು.
ಅದು ಇರಲಿ ಬಿಡೋದು, ಯೂಟ್ಯೂಬ್ ಏನಪ್ಪ ಇರಲಿ ಬಿಟ್ಟು ಇದು ಪಾಸ್ ಮಾಡೋಕ್ಕಾಗತ್ತಾ?
ಪಾಸ್ ಆಗಲ್ಲ.
ಕ್ಲೋಸ್ ಮಾಡಿಬಿಡ್ದೆ,
ಕ್ಯಾನ್ಸಲ್ ಮಾಡು.
ಹಂಗೆ ಇರಲಿ ಬಿಡು.
ಅದು ವಿಡಿಯೋ ಆದ
ಇದ್ರಲ್ಲೂ ಆನ್ ಮಾಡ್ಕೊಳ್ಳಿ ಅಬ್ದುಲ್. ಇದ್ರಲ್ಲಿ ಹೋಗ್ಬಿಟ್ಟು ವ್ಯೂ ಬರ್ತಾ ನೋಡಿ, ನೀವು ಜಾಯ್ನ್ ಆಗಿದ್ರಲ್ಲಿ ಬರ್ತಾ ನೋಡಿ, ನೀವು ಜಾಯ್ನ್ ಆಗಿದ್ರಲ್ಲಿ ಹಾಂ ಇದ್ರಲ್ಲಿ ಜಾಯ್ನ್ ಆಗಿ.
ಪ್ಲೀಸ್ ಕ್ಯಾನ್ಸಲ್ ಇಟ್ಟು.
ಇರಲಿ ಬಿಡಮ್ಮ, ಡೋಂಟ್ ವರಿ, ಇಟ್ಸ್ ಮೈ ಯೂಟ್ಯೂಬ್ ಬರಿ.
ನಾವು ಬರ್ತೀವಲ್ಲಿ.
ಏನಾಗಲ್ಲ ಬಿಡ ಬಂದರೆ ಹಾಂ ಇದ್ದಿಲ್ಲ ಅದರಲ್ಲೂ ಜಾಯ್ನ್ ಆಗಿ ಅದರಲ್ಲಿ ಇತ್ತು ತೊಗೊಂಬಿಡಿ ಈ ವ್ಯೂ.